Okay, pulling your slides up, Amy. Thank you.
Would you like to advance them, Lindsay, or can I? Is there probably a way?
Oh, can you see them?
Yes. Sorry, you guys froze for a little bit for me. Do you want to advance them or do you want me to do it? Is there a way for me to do it?
Not that I have right.
Okay, that's fine. All right. So, okay, so I think Noreen and Tom, everyone really set us up for this knowledge burst right now because we're going to talk about social behavior. So our objectives for today, we're going to review the definition and features of social behavior, examine how we acquire early social behaviors, evaluate social behaviors in toddlers with and without autism, and then analyze the difficulties and strategies on how we measure social behavior. Next slide. So what is social behavior? So if we look at the definition, it's adherence to culturally defined expectations or rules for guiding behavior within interpersonal contexts or interactions. So there's certainly similarities across culture, right, in the types of social rules or social norms. So most cultures will teach their children to be considerate, right, to play fairly in sports or board games, show respect for grandparents and elders. But there's also significant differences across cultures and ethnic groups, right? So let's, when we think about salutations or greetings, right? In some cultures, you kiss, in some cultures you shake hands, in other cultures you bow. So there are definitely differences. And then there's this whole person situation interaction. So what I do is not what you do in certain situations, right? So how we respond, our behavior is going to depend on our personality and our own personal characteristics, as well as the situation itself. Next slide. So how is social behavior acquired? So many skills are innate, right? We're born with them. So infant social smiling, early imitations of sounds or movements. So there are certainly neurological underpinnings, right? So newborns have a visual preference for facial features and for biological movement, right? Some social behavior is explicitly taught. So many of us will teach our children to say please, to take turns during play or share with our siblings. And other times it's incidentally learned, right? So it's just through everyday experiences, such as with other classmates or peers. Go ahead, Lindsay. So if we dive a little bit deeper into innate social behavior, so at 2 to 3 months, infants will have a social smile and they'll respond to parents' voice. At 8 months, they follow parents' eye gaze. 10 to 12 months follows a point and looks back at their parent. At 12 to 14 months, they'll initiate their own pointing, and at 15 to 16 months, they'll draw their parents' attention to an object of interest. And we'll talk a little bit about these skills on the next few slides. So what types of behaviors are explicitly taught? So we mentioned salutations or greetings, right? And this is really the foundation and start to any type of social interaction or relationship. Manners, right, are taught. So this is how do we cooperate with others? How do we share? Manners are taught in childhood, but we use them throughout our whole lives, right? We use them every day with our colleagues, right? When we're working in groups or on projects. Waiting and turn taking is really important. I love that book, Waiting is Not Easy by Mo Willems. All of his books are social stories. So it really helps kids understand things like waiting or going to a party, things like that. Following directions is really important. Many people think following directions has to do with receptive language, like understanding the actual language that is being told to you, right? But really it's about safety, right? And it's about, and listening kind of goes hand in hand with that as well. So, and listening shows that we care about what somebody else has to say. Okay, next slide. Then there's incidental learning, right? So this is learning within the context of everyday social interactions. It's organic, it's experiential, it's watching and imitating the behavior of peers and observing the consequences, whether they're positive or negative. So that's your child, your toddler observes another toddler throwing a tantrum in the supermarket because they didn't get what they wanted. The parent gives them that toy, right? Your child then learns very quickly that they can imitate that behavior the next time they'll get what they want. So it's about learning the meaning and use of nonverbal social cues, such as facial expressions, like eye rolling. I always laugh at eye rolling because I'll never forget when my kids learned how to roll their eyes. And I was like, where did you learn that, right? Well, they learned it from me, right? I probably did it first. So they're imitating what I'm doing. Tone of voice, right? Is it an angry tone? Is it a sarcastic tone? And then, of course, gestures and body language, right? Like shrugging one's shoulders. So you'll see toddlers learn these gestures, right? And they'll try them out in certain situations. Sometimes they'll be correct and sometimes they won't, but then they'll learn and they'll adapt. So part of it is decoding, right? Decoding the different ways these cues are expressed. and then understanding how to change one's behavior, right? Based on the knowledge you've already gained. Next slide. So Jamie already kind of talked about this. So social interactions are really complex, right? There's a lot that goes into it. So at the center of all this, there's a lot of factors, right? What's the purpose of the interaction? Is it to request something you want, to share something? What modality is used? Are we using verbal communication, nonverbal, gestural communication? Who are the social partners? Is this a familiar person, an unfamiliar person, a peer, an older child, an adult, a grandparent? And then there's, of course, initiation and response, the frequency of the interaction, the synchrony amongst partners, that kind of give and take, serve and return, the clarity. And then as Jamie nicely put earlier, it's about coordination, integration, and timing. All of it has to kind of work together to lead to a successful social interaction. Next slide. So at 10 months, children will respond to another person's bid for their joint attention. So this is when the dad says, "Look, Johnny, a bird," and then points and looks, okay? And then at about 12 to 14 months, a child will then look back to dad to make sure that he saw that he looked, right? He's checking in, saying, "I did see the bird." He doesn't have to say anything, but he's using that eye gaze to respond and interact. Okay, next slide. Initiating joint attention is a little bit more difficult for kids, right? Because it is more socially motivated. At 12 months, a child will point to request, right? Just like you see that, and I'm talking an isolated point, one finger, not a reach with an open hand, not a taking your parent's hand and putting it near the object. It's an isolated point, distal point. And then by 14 to 16 months, they'll point to show, okay? Responding, the previous slide, is easier than initiating, right? Because of that social piece. Okay, next slide. So this is a summary of social emotional communication milestones for everybody. I'm not going to go through this at length, but this will be a good resource for everybody. So, we're seeing kids, really between 24 and 48 months, right, while we're doing the stat. And so these are just some things to look for, right? So as early as 9 months, we see several facial expressions. They look at you when you call their name. They smile and laugh when you play peekaboo. There's a lot of reciprocal vocalizations, babbling, cooing, etc. At 15 months, they show an object. They point to request. 18 months, they check in with a parent. Sometimes just at the very beginning of a visit when I'm talking to parents, I just think in my mind, I keep a little tally. How often is the kiddo checking in with their parents? Are they only focused on the toys and the objects in the room? Or do they check in with their parents to see, to either show them something or even just get comfort, right? At 24 months, they should have 2-word meaningful phrases, right? And use gestures. And at 30 months, I really like this new milestone. They added this to the 2022 milestones, but this concept of look at me at 30 months, right? So a 30-month-old loves attention, right? And they will seek that from their parents, and they do things like, look what I'm doing, and hold stuff up. So always consider that when we're seeing our kiddos. Okay, next slide. So why is it challenging? So it's very challenging when we measure social behavior. So why? So developmental milestones for social behavior are much more nuanced and subjective than those for other areas. So if we look at the motor milestones and compare them with the social milestones at 12, 15, 18, 24 months, it's pretty clear cut and concrete, right, for motor milestones. Pulls up to stand, starts walking, walks independently, and runs. But those social milestones are a little bit harder to elicit, right? So playing games with your child. Yes, my child plays games. What kind of games? What does it look like? Shows you an object they like. Well, what kinds of objects are they showing? How are they doing it? Points to an object of interest at 18 months. And at 24 months, looks at your face to see how you react to a new situation. So these milestones are definitely more qualitative or subjective. How often does it occur? How consistently? In what context? Is it only with their speech therapist? Does it generalize to the home and community environment? With whom, right? With eye contact, and is there positive affect? Are they sharing enjoyment like smiles and facial expressions? Next slide. As I mentioned, so the evidence-informed milestones were revised in 2022, and there was a lot going on at this time, right? So, but I thought people were excited about it. Some people were not as excited about the changes, but I'm going to go over kind of what they are and what they are not, okay? So we'll start with what they are not. So they are not validated screening tools, these new milestones. They are not standards or CDC guidelines, and they are not used to diagnose delays. They are evidence-informed. They are meant to be communication tools and checklists for developmental monitoring, mostly for surveillance, right? The goal was to prompt conversations to help providers review developmental history and progress, and to help them elicit concerns from parents. Okay, next slide. So why did they revise? It had been 15 years since they had revised the developmental milestones. So it had been quite a long time, and they were using old data. There were no 15 and 30-month checklists, and we had added those well child care visits within that time frame. Previously, they used language like may, start to walk, begins to use two-word phrases, and these phrases were quite vague, so they took those out. And then there was a question of how many milestones can be missing without being concerned, because people weren't sure, well, when do I refer? How concerned should I be? They used terms like warning signs, right? And so certain providers only focused on the warning signs and not each individual milestone. And then were these the milestones that most children do at this age, or 50th percentile is what they had previously used? And most importantly, which kind of pertains to what we're doing here, is there were significant gaps in developmental data for social, emotional, and cognitive milestones, which they helped kind of fill in, and they actually reclassified some of the milestones into different categories. Next slide. So a quick overview. Autism is a neurodevelopmental condition characterized by two features, right? Challenges in social communication and interaction, and the presence of specialized focus and intense interests. It presents early in life, and really importantly, it's expressed differently from child to child and across time. Next slide. So early supports are key. So in this study, they looked at the percentage of children who had optimal outcomes and if they received early intensive interventions compared to those who later on were classified more as high functioning autism. Those who kind of were in the optimal outcomes category, a higher percentage of that population received early intensive supports, specialized services and supports, which led to optimal learning and development. So early diagnosis and early supports are key. Next slide. This study was recently published in the fall. It was out of Boston Children's and published in JAMA Pediatrics. And what they did was they looked at children who were diagnosed at 12 to 36 months. They looked at their cognitive functioning, their language functioning, and their adaptive skills. And then they measured outcomes when children were 5 to 7 years old, so when they were school age. And what they found is that children who had higher adaptive skills at the onset, right at baseline, had the best outcomes, as well as female sex. I thought this was a great study. It showed that some children actually went on to have non-persistent ASD features. And so it's important to familiarize yourself with some of these studies so that when parents ask you, will my child grow out of autism, right? You really can't say no, right? Because there's a lot of literature coming out suggesting that children may no longer meet full criteria when they're older, when they receive kind of these early supports. Next slide. So what are some features of social communication in autistic toddlers? So certainly they have delays in development and use of spoken language. So and this is in the area of using conventional words to convey needs, interests, desires, or dislikes. And they have challenges in understanding the language used by others. So that could be facial expressions, gestures, verbal directions. So that's the why. They also have delays in development and use of nonverbal forms. So conventional gestures like pointing, nodding their head, and understanding these gestures, like tone of voice, like I just mentioned. And then they have difference for the reasons they are communicating. So many autistic toddlers will learn how to request, right? We talked a little bit about that earlier. They'll learn how to protest or reject something by shaking their head no or waving their hand to say they don't want it. And many times they learn how to greet, right? And these skills can be learned by rote. So they are learned through practice and memorization. But what's harder, I think, skills for children, for autistic toddlers to develop are to share interest and enjoyment with another person. So this is through joint attention, and it's very social. To comment. So that's the chit chat, right? It's cloudy out today, right? That kind of stuff. And then to ask for information. When's daddy coming home? These are a little bit harder acts of social communication. Next slide. As we mentioned earlier, Jamie, I think you said this as well, social behavior is not an all or none skill. So they are not completely absent in toddlers with autism. There is just considerable variability in their levels of social interest and engagement. And as Jamie mentioned, autistic toddlers do demonstrate social behaviors. They have attachment to parents. They show affection. They give eye contact, and they imitate. But these behaviors occur less consistently across people and settings. They might be more situation specific, or as I mentioned, routinized, kind of learned by rote. Caregivers may have to work harder to elicit them. Oftentimes, parents will say, oh yeah, they look at me, and they end up doing kind of like gymnastics, right, to try to catch their child's eye gaze. There may be qualitative differences in the timing and flexibility, clarity, and coordination. And again, going back to that integration of behaviors is so important. Okay, next slide. So I want you guys to just remember quality, frequency, consistency of all of these skills. Not all or none. It's about quality, frequency, consistency. Okay, next slide. Why is joint attention important? So joint attention is the foundation for learning from another person, like a teacher or a therapist. It's the foundation for communicating with another individual. Strong joint attention skills lead to positive language development and better outcomes in cognition, language, and symbolic play. Such an important skill for safety, right? So this is a child responding to their name when they're about to run into the street, right? Johnny, stop, right? Very important. And then of course, when children have joint attention and improved communication, you're going to see less tantrums. Okay, next slide. So how do we measure social attention in toddlers? So we have informal practices, right? So we can observe a child playing, right? Or look at videos that parents show us. We set up situations or presses to elicit social communication. So you might be, talking to the parent, and you might just say the child's name, Johnny, to see if he responds in the clinic. And then asking caregivers the right types of questions, with which, Noreen mentioned earlier today. And I'm going to talk a little bit about in the next couple of slides. And then we use formal diagnostic measures like an ADIR interview, which you guys are using kind of a verified format of that. Screening tools like questionnaires, and then diagnostic tools like the ADOS or the STAT. Next slide. So here are some strategies for interviewing. So requesting behavior. Oftentimes when we ask questions, we say, does your child do this? Do they do this? It's kind of the do's and the does. And I challenge you to rephrase your question and make it more of the how and the what, right? So it's not, does your child let you know they want something? It's, how does your child usually let you know they want something, like food or toys? How does your child request objects? What kind of objects do they request? Do they, how do they let you know they're awake in the morning? I love this question because, many times parents say, well, I just know they're awake. Well, do they call out? Do they say, Mom, Dad? Or do they just kind of like wait for you to come get them? How do they let you know when they want more of something? How do they let you know they need help? And then other than yourself, who else will your child make requests to? Is it just with one person, just you, or just with their therapist? Or will they ask grandma and grandpa for help? Next slide. So when we ask about directing attention, again, how does your child get you to look at something they're interested in? Not because they just want it, but something interesting. What are some examples of this? What do they point at to show you? I often have families who will say, he loves garbage truck. He'll go up to the window every Friday morning and he'll point at the garbage truck and he'll say, garbage truck. And then I'll say, yeah, but does he actually look back to see if you're looking with him, right? And I'll demonstrate to parents. I'll say, does he point, look at the garbage truck, look back at you, and then look back at the garbage truck? And I will look the parents directly in the eye when I demonstrate this. Sometimes demonstrating it and just asking those questions in slightly different ways, diving a little deeper, as Noreen said, you can get a lot of really rich information that you wouldn't otherwise get if they were yes/no questions. Okay, next slide. When I ask about play, many times, we'll say, what does your child play with? And they might say, they love to play kitchen. They love to play with the pots and pans and the Tupperware. So then I'll ask, well, what does your child do with them? And they might say something like this, loves to line them up along the edge of the carpet or the rug in the kitchen. Oh, that's interesting. Tell me more about that, right? How does he play with it and what does he do? Oh, my daughter loves to play tea party. That sounds great. So tell us, what does she pull you in? Does she include you in her play? What does she do with the teacups and the little pots and the spoons? And so I think you can get a little bit more information from parents if you, again, just ask how they're doing it, what they're doing it, not just what they're playing with. Okay, next slide. So this takes us to play. Play is the work of a child, right? It's what they do every day. It's how they learn and experience their world and how they take it all in. You can assess every area of child development through play. And I know this is a busy slide, so I apologize. We don't have to go through all of these skills, but you start at the very top. Through play, you can look at verbal language. And what I did is I put the DSM-5 criteria kind of mapped onto it so that you can think like through verbal language, we can look at A1, A2, and B1. Through social interaction, right, that's A3. Gestures, right? We see a lot of gestures when we're playing with kids. That's A2. Behavior regulation, B2. Facial expressions, A2, right? Are they smiling in, response to you? Are they giving you good facial expressions? Eye gaze, gross motor, right? So are they doing any repetitive motor movements, running back and forth, running in a pattern in a circle at home? What does their coordination look like? Giving, showing, and sharing during play, that's A1. Fine motor skills, so as they stack blocks, do they just stack blocks? Do they line things up? How do they play with the toys with their hands? Imitation, play should be shared, pretend, and with peers, right? So that's A3. We can look at sensory processing. How do they handle, music? How do they handle singing voices? How do they handle, different textures on toys, etc.? And then what are their strong interests, right? Do they have a highly specialized interest in something like Thomas the Train, right? And is it to the extent that we wouldn't expect it to be, right? Like a very deep, intense interest in it. Okay, next slide. I love this video. I think we have, okay, I don't think we have time. It's a wonderful, wonderful video. I really encourage you guys to Google it. It's on YouTube. It's two 18-month-old toddlers who are talking with each other back and forth. They're not using real words. They're kind of babbling. Are you going to try? Are we going to try for it, Lindsay? Or no?
Let's just keep going.
Okay, next. But I really encourage, it's really fun to watch. It just shows so much beautiful interaction between two 18-month-olds. Okay, so this study came out. I like this study. This is what they did was they took, Lynn and I talk about this all the time, but they took the ADIR and they developed algorithms for younger children, for preschoolers from 12 to 47 months. And they looked at children with autism, children with developmental delay and not autism, and typical toddlers. And these were the items that differentiated autistic toddlers from non-autistic toddlers. So this will give you the most information when you're asking these questions. They mapped it onto age and language level. So the left-hand column is age 12 to 20 months, and nonverbal kiddos from 21 to 47 months. The middle column is single words, so that's SW, 21 to 47 months. And then the third column is phrase speech, 21 to 47 months. I'm not expecting you guys to memorize that and kind of pull those items for the kiddo who fits into that category, but I just wanted to let you know kind of where the high yield information is going to be at. Okay, next question. Or, sorry, next slide. Okay, so typical children have a strong motivation to communicate when they can. So at 13 to 14 months, babies make it clear when they don't want something or when they don't want to do something. So remember that. They'll sit in their high chair, they'll throw their food off it, and they'll say, no, I don't want it, right? So eye contact, gesture, word equals a refusal. Next slide. So here are some behavioral presses. You guys are going to be doing this in the stat, which is great. And things to look for. So one thing I just want to point out on this slide is sometimes doing nothing can give you a lot of information. So just sitting back and observing the child while they're playing in your office gives you so much information, even more information than when you are actually, initiating a press and trying to get information through testing. Go ahead, Lindsay. So it takes time and practice. Dr. Harlan and I talk about this all the time about pattern recognition software. You have to just kind of get used to what you're seeing, and over time, it'll get easier and easier. Next slide. We talk about autism as a spectrum, right? And some people think of it as like a linear spectrum. And I like to remind parents that it's more about a profile. And every profile is so very different, right? So if you know one child with autism, you know one child with autism, right? They're all going to look so different. And it's important to keep that in mind. They'll have strengths and difficulties in different areas, and that will change over time. Thank you, everybody. Sorry I went long.
Wonderful.
Thanks, Amy. That was so amazing. Oh, sorry.
Oh, well, thank you. This is just kickstarting many conversations to have in the next 12 months here. So thank you so much. We will meet again on April 25th from 12:30 to 1:45 Mountain Time. The topic is Understanding ABA, how to support common behavioral strategies, presented by our panelist, Julie Whitman. So Hong Yan has placed information so that you can claim your CEs, CMEs with our new format. If you run into any trouble, reach out to us. We'll get you where you need to be. So thank you to all of you. Take care. Bye.